Hello, everyone. Thank you for joining me on this session. This is a topic that has come up so much over the last few months. And I know a lot of people are seeing messages and information and articles on LinkedIn and Facebook and other places about menopause and starting to talk about perimenopause as well. So before I go into things, I'm going to introduce myself. My name is Gloria Han. I am a board certified award-winning holistic health practitioner, and I have been working on women's health for the past about 10 years or so. And my focus is on hormonal health because through my own health journey, having gone through breast cancer, hormone receptive breast cancer, hormones being involved, and going into menopause at an early age, and then drug induced that is, and then coming out of it, and now in the stage of going through the perimenopause stage. I am going to go through today the stages of a woman's reproductive life, what perimenopause is, learning about the symptoms of perimenopause, and also share some tips and tools that I use on a daily basis to support myself and my clients to live more of a balanced life than going through the crazy symptoms. So my intention for today is to help you understand, like I said, what perimenopause is, how the change in hormones affects you as an individual, your body, and also share, with you some tools to help you to help support you. Again, like I said, through the transition, but not utilizing conventional treatment, but utilizing the holistic therapies that are, available to us as individuals and planet we live in these days. Okay, so here's the thing: many women are suffering with these, with these challenges, and a lot of them tend not to understand why. Why is this going on? I understand how tough it is, and I do actually want to get you through this. There's a small percent of women who thrive through perimenopause and are on top of the world. They look radiant, they look beautiful. They don't even know that they're at that stage in their life. So here's the thing: let's go through the stages of a woman's reproductive life. So you have what they call the premenopausal years, which is the active years of reproduction and fertility, ages between 20 to 30. And then you head on into the perimenopausal phase, which starts, usually in a woman's early 40s, but there are a group of women that actually start presenting with perimenopausal symptoms mid-30s, some very few, a small number, early 30s as well. And then you have the menopausal years, which on average, the average age of going into menopause is 51. But the thing is, it doesn't happen that way for every woman. So what I tend to tell people, or ask them, the question I tend to ask them is what age, because it goes in that, the biology of it goes in that way, what age your mother went into menopause. And if it's, say, for example, 55, you are likely to go into menopause around that time. It's not on point, but around that time is what they say. And then you have the postmenopause years, which I think is a bit redundant. But it's there you have it. And menopause is defined as the period that starts 12 months. You have to have not had your period for 12 months. So 12 months after a woman's last menstrual cycle, then you are classed as menopausal. So what is perimenopause or menopause transition? It begins several years before menopause, and it's the time when the ovaries start gradually begin to make less estrogen. which is one of the reproductive hormones. And this kickstarts the shift from regular menstrual cycle to sometimes what could be hormonal chaos before menopause starts. And it varies from woman to woman, of course, but it usually lasts a period of between 4 to 10 years, right? So, and like I said before, it usually starts for women in their 40s, but there are women who start earlier in their 30s. And for some women, perimenopause can come on gradually and in the midst of any life changes that the symptoms mostly go unnoticed, even for several years. These changes differ from woman to woman. However, the main change is that your ovaries no longer start on point with monthly ovulation. They start going offline intermittently, and ultimately they stop producing eggs altogether. As this happens, many women feel like they've fallen into a space of utter crazy, where from one day to the next, or each day, each hour, and sometimes each minute feels like an increasingly challenging game of survival. And the long list of perimenopausal symptoms tends to creep up between the ages of 35 and 45, and sometimes predates changes in your period. So typically, those symptoms or clues involve your mood, sleep, weight, and we're going to go into the symptoms of perimenopause in a bit, but this gives you an idea of some of the symptoms that women tend to go through. So why does this happen? So just as in in the years prior to your first period, hormone levels are once again chaotic. Okay, so puberty is very difficult, and then you feel like you've gotten that balance, and then you get into the space of another cycle of utter hormonal chaos. During perimenopause, you need your ovaries, your adrenal glands, and your thyroid glands. They have to be working at their best for you to feel your best. But several things tend to conspire against you. It feels like they're conspiring against you, right? So the first thing is you have the aging process that's unfolding. You can't do anything about that. This is nature, it's life, right? And the process is also unfolding in your ovaries. You are no longer ovulating every month. So your periods get shorter in frequency, or they will get longer, or altogether become totally unpredictable. A lot of women have presented with, long periods. The periods lasting longer than usual, or it's shorter, it's lighter, it's heavier. So anything could not happen. And then the second thing is your thyroid becomes sluggish. Your metabolism slows down. Your weight climbs even if you eat less and exercise more. And this is where the weight gain comes into play. You start to feel depleted and your mood becomes erratic. So because your thyroid slows down, your metabolism, even as you age, your metabolism slows down anyway. And then if your thyroid becomes sluggish, which also regulates your metabolism, this is where the reason why a lot of women tend to put on weight during the perimenopausal and sometimes menopausal periods as well. So, and then the third thing, as if all that wasn't enough, simultaneously your adrenal glands get in on the act as well. With all these hormonal changes, your stress response becomes heightened. That's cortisol. So you can't just roll with the punches like you used to. You can't focus or concentrate. Neither do you have the energy to get anything done. After a long day at work, you've put your kids to bed, and before you know it, it's midnight. So when you put all this together, and you have what one of my mentors, Dr. Sarah Gottfried, calls the perfect neuroendocrine storm. All three hormonal systems, ovaries, adrenals, thyroid, conspiring against you to bring you down. And then what happens? Sugar, alcohol, chocolate become your daily best friends. So here's the thing. Treating the ovaries, adrenal, and thyroid axis imbalance has to be approached from a holistic standpoint. fully understanding all the components that are involved. However, it can be done, right? Not with conventional all the time, but it can be done. Now, work with me, bear with me. We'll work together to help you reclaim your hormonal balance so you feel like yourself again. But let's talk about the symptoms of perimenopause, right? Remember, I mentioned a few of them a couple of slides ago. So during perimenopause, ovarian function and estrogen production start to become erratic. That's a given, right? Which means your cycle becomes somewhat unpredictable. It's common for many women starting in their early 40s to begin noticing signs of perimenopause, including, like I mentioned before, the irregular periods. They can happen 2 to 4 months on average at first, and then further and further apart. Periods can get heavier, they can be lighter. So you never know what you're going to get from one month to the next. You start experiencing hot flushes and night sweats. This feels like heat suddenly starting to spread throughout your body, often causing sweating and redness. A hot flash is the term given to the redness that's caused by an increase in body temperature, right? You have insomnia and changes because, in sleep quality. I talked about the weight gain, especially in the abdominal area, changes in sex drive, weight gain, and your hair starts to thin out. You have dry skin, decreasing breast volume, mood swings. That's a big one. This can include feeling like you're always tired, increased irritability, anxiety, a lot of anxiety going on, fatigue, and depressive symptoms. Heart palpitations. This is caused by changes in blood vessels, heart, and autonomic nervous system. Palpitations might occur during hot flushes or with anxiety, muscle spasms, and headaches. And then there's also the way you get migraines and frequent headaches. Reduced blood flow, lack of sleep, anxiety, and other problems can contribute to frequent headaches. Then there's poor concentration as well. So here's the thing: estrogen and testosterone play a role in memory, motivation, and mood. And it's common to start noticing loss of concentration, you're forgetful, some drowsiness, and decreased reactions to stress. These symptoms can also be worsened, when there is also, coupled with the fact that you're having poor quality sleep and increased anxiety because of the hot flushes and night sweats. So it's kind of like, whoa. And then you've got, vaginal dryness as well, because estrogen levels have dropped, because estrogen is responsible for, lubricating your vaginal cavity, and it's crazy. So physical signs such as irregular bleeding and hot flushes might start to come and go even earlier, starting in late 30s, as I mentioned before, right? So what are the causes of perimenopause? So during each of the major reproductive phases of a woman's life described above, various hormonal glands in the body work together to control how much of each hormone is produced. At the most fundamental level, perimenopause is caused by a sudden increase in hormone fluctuations. And there are two major reasons for this to happen. First, as you can see, hormonal causes, they result in the visible signs and symptoms of perimenopause. This involves the natural hormonal fluctuations that accompany aging and eventually lead to an end of the reproductive years. Then the external causes involve things like stress and medical procedures that can trigger hormone symptoms. So the level of stress you go to on a daily basis actually has a direct impact on perimenopause. So, and a major hormonal change involved in perimenopause, menopause, and postmenopause include estrogen, progesterone, and testosterone. And while other hormones are also usually shifting and involved, including serotonin and insulin and cortisol as well. These three, estrogen, progesterone, and testosterone, have the biggest influence over a woman's reproductive capabilities, especially estrogen. So from the age of 35 to 50, estrogen drops by 35%, and progesterone and testosterone drop by 75%, right? This massive hormonal shift changes the biochemistry of your body and causes a wide range of challenging symptoms, like we've talked about earlier. So let's delve into these three hormones to get a bit more of an understanding of what happens. So estrogen is a sex hormone, is a reproductive hormone that's necessary for maintaining your sexual and reproductive health. Estrogen levels naturally fluctuate during your menstrual cycle and decline during perimenopause. That's why when they start to decline, that's why you start to feel the hot flushes, you get the vaginal dryness, the night sweats, everything. It's because of that dip in estrogen. So the ovaries and adrenal glands and fat tissues produce estrogen. Both female and male bodies have this hormone. Both female and male have this hormone, but females create more of it, right? So let's talk about, there are three types of estrogen. So you've got estriol, estradiol, and estrone. So estrione is the primary form of estrogen that your body makes after menopause. That's the last one, estrone. And then estradiol is the primary form of estrogen in your body during your reproductive years. It's the most potent form of estrogen. Too much estradiol may result in acne, loss of sex drive, osteoporosis, and depression. However, very high levels can increase the risk of uterine and breast cancer. That's when you go into estrogen dominance. However, low levels can result in weight gain and cardiovascular disease. So another reason why women tend to put on weight during that perimenopausal and menopausal phase is because estrogen is low, estradiol to be precise. And then you have the last one, which is estriol. And this is the primary form of estrogen produced during pregnancy. So drops in estrogen can lead to sudden weight gain, as we've talked about already, cravings for sweet, high-fat, or salty foods, the hot flushes, night sweats. You've got aches and pains in your knee, hip, and joint, dry, thinning hair, eyebrows, dry skin, rashes, wrinkles, the vaginal dryness and irritation, and constant fatigue and exhaustion, right? So that's estrogen. Now let's talk about progesterone and testosterone. So progesterone is a hormone released by the ovaries. Changing progesterone levels can contribute to abnormal menstrual periods and menopausal symptoms. So when you're perimenopausal, like we said, progesterone drops by 75%, right? So that is why you have the change in your cycle. It goes erratic. Progesterone is also necessary for implantation of the fertilized egg in the uterus and for maintaining pregnancy. Okay, so with testosterone, this is a hormone found in all humans as well as in other animals. In men specifically, the testicles primarily make testosterone, but women's ovaries also make testosterone, though in much smaller amounts. So a drop in progesterone results in trouble falling asleep, because progesterone is also known as the keep calm and move on hormone. It helps you to sleep. So that's why when you have disturbed sleep, apart from the night hot flushes and night sweats, that drop in progesterone is another reason why your sleep, you're not able to get good quality sleep. It results in anxiety and stress, mood swings, sadness or irritability, and hormonal headaches as well. So combined with estrogen, testosterone helps with the growth, maintenance, and repair of a woman's reproductive tissues, bone mass, and human behaviors. An imbalance of testosterone in the female body can have damaging effects on a woman's health and sex drive, right? So here's the thing, too much testosterone, you get all the skin, acne, breakouts, hair loss, insulin resistance, irregular cycles. And then with low testosterone, you have difficulty building muscle, low motivation, poor sleep quality, depression, fatigue, mood swings, right? So a drop in, testosterone leads to, like we said, low libido, difficulty achieving orgasm, loss of muscle strength and tone, and slow recovery from exercise and exertion. So if you go exercising and you feel, tired, or you can recover quickly like you used to in your 20s and 30s, that you want to get your testosterone levels checked out. So, like I said, I think I mentioned already, stress does affect it does affect your cycle. It does affect your perimenopause, how perimenopause presents itself in your body. Now, stress is the body's natural response to everyday situations. It's termed the fight or flight, which is your body's natural alarm system. So when you're stressed out, your body releases cortisol, which is the main stress hormone. This has an impact on insulin and all of the other hormones if it stays that way for a very long time and left unchecked. Because here's the thing, the human body was not built to stay in a high, intense fight or flight mode for a long period of time. You're meant to go into that fight or flight mode and then come down from it. But in the world we live in that's so stressed out now, we are living in a heightened stress mode for a long period of time and not able to calm it down. So we want to, as much as possible, check in with our stress levels and find ways and adopt tools, pick some tools to help support the stress levels, right? So let's talk about what treatments are available for perimenopausal symptoms. So yeah, as obviously we know that there are conventional treatments. Those are usually the treatments that people zero in on straight away, and they come in the form of hormone replacement therapy or progesterone cream. So let's talk about hormone replacement therapy. Hormone replacement therapy are made out of synthetic hormones. This is synthetic hormones, which the body will not understand. So if you are having heightened perimenopausal symptoms and you opt for HRT as a treatment, the first 2 weeks on average, I've seen a lot of women on average, the first 2 to 3 weeks, the symptoms that they were having, hoping to calm down using the HRT, are heightened even more, right? They feel like it's worse, it's just made things worse. So here's the thing, like I said already, HRT is synthetic hormones. The body does not understand it. And it's already in a phase of hormonal crazy. And once you introduce synthetic hormones into it, that creates an astronomical storm that the body is not able to cope with. And then you as an individual feel like you're losing your mind, right? So somebody's just asked me, how about bioidentical hormones? Great question. So we're going to talk about bioidentical hormones, but I'm not going to go into it too much because I feel like I'm going to do a class on HRT and bioidentical hormones because I think it deserves the space to go into more detail with that, so people, women out there can, make a better choice for themselves if they opt for the HRT or bioidentical hormones, which are classed as more natural hormones, then you go in with your eyes wide open and knowing what you're going to get out of it and knowing what the side effects will be. So I will be doing a separate class on HRT and bioidentical hormones. But just to go into it briefly, bioidentical hormones are processed hormones designed to mimic the hormones made by your body's glands. So these are derived from products like, from plant and animal sources, rather than being created synthetically in a lab like all the other normal conventional HRT products. So estrogen, progesterone, and testosterone are the most commonly used bioidentical hormones, right? And then you have what is called compounded bioidentical hormones. And these are advertised as being safer, more effective, natural, and individualized alternative to conventional HRT. However, here's the thing. These claims remain unsupported. It's been shown in research studies that there are risks to taking hormones. Some healthcare providers who prescribe the bioidentical hormone HRT products would perform a saliva or blood test in their patients first in order to assess their unique hormonal needs and then prescribe customized treatment solutions. This is called custom compounded or custom mixed hormone therapy. Not all bioidentical HRT is customized. There are also FDA-approved hormone therapy products that are commercially available, which are not specialized for each patient, and those that are not naturally produced. Here's the other thing. The FDA have reported, although I don't always go with what the FDA says, but anyway, but they have reported that according to clinical studies, hormones that are marketed as bioidentical or natural don't appear to be any more effective or safe compared to hormones used in traditional hormone therapy products. Where the FDA is concerned, there's a whole feeling around what the FDA puts out there. But again, to an extent, I would agree with that because some research also shows that hormones that are marked as bioidentical might not be much different at all from those in traditional hormone replacement therapy and might even be riskier in some cases, especially when it comes to the custom mixed or the custom compounded HRT. And then you have progesterone creams as well. So here's the thing. The reason some women turn to these is that they can help mimic or replace some of the decreasing reproductive hormones, such as estrogen and progesterone, and therefore diminish some symptoms of perimenopause. Unfortunately, these treatments also have some risks. Studies show that taking hormone replacement therapies can increase a woman's risk for several serious diseases, including breast cancer, heart disease, stroke, blood clots, urinary incontinence, dementia, memory loss. It seems like a lot, I know, but there are also women like me who, having gone through the breast cancer phase, cannot in any way, shape, or form introduce any form of synthetic or bioidentical hormones into my system, because that would be crazy to do that, having gone through what I've gone through. So some common side effects of HRT or bioidentical hormones include weight gain, blood vision, acne, increased facial hair. You could get headaches, breast tenderness, spotting, cramping, bloating, and even mood swings as well. So same, again, like I said, when I started talking about HRT, it heightens the perimenopausal symptoms, at least in some women for the first 2 to 3 weeks, and then it could even out. But some women, for some other women, I've been in a lot of Facebook, perimenopausal Facebook groups that some women can't even tolerate it because even after the 2 to 3 weeks, they're still getting the heightened symptoms, so they have to come off it. Like I always say, everybody is different. Okay, so you want to be careful and you want to do your research and work with your healthcare provider to find exactly what works for you. The other thing that may come out of the HRT is you may itch and get red around the area where you apply the hormones if you use a patch, a cream, or a gel. That's what's available on the market, right, or in the industry. So yeah, like I said, you need to, so most women make the mistake of trying to treat their symptoms, right? So what you want to do is, focus in a different way, right? Your symptoms are definitely a red flag. So instead of trying to, instead of doing things like trying to overcome exhaustion with caffeine, carbs, and sugar, and instead of trying to lose weight by dieting, there are other ways which I'm going to go into shortly. And then you need to get to the root cause of where this is stemming from. As your ovaries start to shut down, your body goes from hormonal harmony to roller coaster. It is better and safer to focus on balancing your hormones rather than replacing them artificially. Okay. Once hormonal balance is restored, it will reduce the stress on your body. And then, when you come to balancing your hormones, how do you do that? Eating the right hormone balancing food at the right time of the day, and then including lifestyle changes, exercise. We're going to go into detail of these in a minute. And then, using this, tips and tools and these techniques, it works for a woman. Even if everything else has failed, then even if you have a chronic condition, in addition to your changing hormones, when you adopt the changes I'm going to talk in detail about, balancing your hormones, lifestyle changes, you will start to see a difference and feel a difference in your hormones and the symptoms you're having, start to sleep better. So let's delve into what the natural holistic treatments include. So the first thing I tend to say to a lot of women, whether you're perimenopausal or or not, is that every woman should know her numbers. Numbers being your hormone panel. That should include estrogen, progesterone, FSH, which is a follicle stimulating hormone, luteinizing hormone, testosterone, thyroid, and cortisol, right? This will enable you know when you start to have changes in your hormones and will match your symptoms. And the other thing, if you're perimenopausal, you want to track your symptoms as well. These go hand in hand, right? You're tracking the symptoms, but you're not treating the symptoms. What you want to do is get your hormones in balance. And that's why it's important for you to have, yes, I know I'm getting a question, don't these numbers change during a cycle if you're in perimenopause, from Leah? Yes, Leah, they do change, but it will still give you an idea of what your numbers are. And then you can use that as a benchmark when you have yourself checked 6 months down the line. Because say you've taken the test, you've done the hormone panel, you know what these numbers are, even though they're erratic, and you embark on a protocol of balancing those hormones, you start to feel better. You do the test again in about 6 months' time. You see how far you've come, you see what the levels are. And once you feel that your hormones are in a more balanced phase, then that is what your ideal numbers should be. And that's the benchmark you use for yourself going forward to stay in a more balanced, healthy state, right? Does that make sense? Jennifer says, can you explain why these hormone levels are important. I've just done that, Jennifer. I hope that makes sense. These hormones vary day to day. Yes, they do. They do, definitely, especially cortisol. And that's why when I talk about getting a test for cortisol, the best way to test for your cortisol is with a saliva test, not a blood test. And the test should be done at 4 points in the day, in the morning, mid-morning, afternoon, and evening, because yes, your hormones fluctuate throughout the day, especially cortisol, right? So you want to check that at 4 points during the day, through a saliva test. Okay, and I do give my clients a hormone panel with the timings of when they should take the test. Like, for example, estrogen is day 1 to 3 of your cycle, progesterone is day 21, 22 of your cycle. So you want to be able to test at the right time. So you want to be able to do this test at the right time through your cycle, okay, in order to keep a track of it. And when you talk about tracking your symptoms, there are loads of apps on App Store or Android where you can download some apps that will help you track your symptoms and also enter what your numbers are to see the changes that are going on, right? This is equipping you to build your own self-care protocol going forward, okay? So the next thing is eating in harmony with your hormones. So we stress, we go on yo-yo diets, there are environmental factors. These are just a few things that you come into contact daily, and they create a buildup of toxins that mimic estrogen and bacteria in your body. So by cleansing and eating the right hormone balancing foods, the weight will come off naturally without dieting. You'll feel satisfied, energized, and the cravings will disappear. So eating in sync with your hormone cycle. Eat in sync with your hormone cycle. So food is turned into energy and not fat. Female specific exercise that burns body fat while boosting energy. Simple daily habits that lower your cortisol and stress. I will go into more detail with this. And when you have a nourishing unprocessed diet, that's key to boosting your intake of essential nutrients. And it will help your body adjust to changing hormones, managing your weight, and reducing your intake of empty calories. Okay, so here's an example. Here's what you need to focus on. Now, the foods that are most helpful during perimenopause include organic fruits and veggies, high fiber foods like nuts and seeds, omega-3 foods, to bring down inflammation. You could also have as a supplement omega-3, 6, and 9, but you get that from nuts and seeds anyway. Your gut health is important, so you need to be taking probiotics as well. Clean and lean proteins like fish or grass-fed meat. Where meat is concerned, I would encourage you to minimize this to 1 serving a week, right? And healthy fats such as olive oil and coconut oil. Foods that supply natural phytoestrogen like flax seeds. So I want to talk about soy because I think somebody did mention something about soy earlier on. Soy, yes, it's a natural phytoestrogen, but you have to be careful and aware of where you get your soy products from, because soy is the most GMO product on the planet right now. So you want to be careful. So the quality of the soy is very important. Okay, so I've worked with a daughter. For me, I tend to stay away from soy product because of what I've been through in the past. But having worked with a natural functional doctor, she has worked with a lot of cancer patients as well. And she said to me that soy could actually be beneficial, but again, like I said, is where you get it from. Okay, so the next thing is exercise. Keeping up with an exercise routine consisting of aerobic and strength training exercise and restorative exercises. If you're already struggling with high levels of stress, at least 2 to 3 times, at least 3 times or more per week. Going for a walk, swimming, yoga, these are exercises that you should try to incorporate into your lifestyle. But if you are already in that heightened perimenopausal symptomatic phase, or you've got high levels of stress, you're in adrenal fatigue, I would recommend short, gentle exercises that would increase your energy, boost your metabolism, and increase your youth hormones. Okay, so if I think I might be going through this too, a bit quickly, but it'll all make sense. This is being recorded, so you can rewatch it later on. So my next favorite, holistic tools, herbs and supplements. Herbs and supplements that can relieve certain symptoms of perimenopause include, I've talked about it already, omega-3 fatty acids, adaptogenic herbs such as maca and American ginseng, black cohosh, red clover, raspberry leaf, vitex, which is also known as chasteberry or agnus castus, sage, and St. John's wort. What I would say here is do your research. These would not work for everybody. So it's a trial and error. Because for me, when I was going through my treatment, sage was one of the herbs that was recommended to me for the hot flushes and night sweat. It didn't work for me, but some other women swear by it. So what you want to do is give them a try and see if it works for you. If one doesn't work for you, go on to the next thing, okay? Another thing is restful sleep. So when you sleep is when your body, heals itself. It's important for restoring energy, for balancing hormones, for keeping your cortisol levels under control and reducing anxiety or depression. And you want to try to aim for 7 to 9 hours a night, but quality sleep. So in order to get that quality sleep, you want to first of all, have a bedtime routine, like shutting off your tech device, an hour before, and, setting your room, making sure your room is cool, it's dark, diffusing some essential oils, whatever it is that you can do to get your body ready for a restful night's sleep. And now we go into my favorite tools, the essential oils. I love, love, love these gems. I call these things nature's gift to mankind. And there are certain oils, this is not an exhaustive list, but these are the oils I tend to use on a regular basis. Essential oils are, tools, they're plant products. But what I would say to you, and this also relates to supplements as well. Do your research. Don't just get any essential oil from any company, because the essential oil and supplement industry are not very well regulated. So do your research to make sure that the company the brand you're about to buy is clean, is pure, and the company's transparent about how they produce these oils. The company I use is called, I've been through so many companies before I landed with doTERRA. doTERRA is an American company, and they produce pure, certified pure, tested grade oils. And these oils, they've given themselves a certification and take their oils through 54 different types of testing. Each batch of oil they produce, it's gone through 54 different types of testing. So that's a lot of testing to get you pure oils, okay? So if you want information about doTERRA, reach out to me, I'll be able to support you with that. So clary sage and ylang ylang both will balance out your estrogen levels. Wild orange, it's an adaptogen in the body and can calm or uplift you depending on what you need. So a bit of caution here, this is photosensitive, so use at night, or if you use it during the day, avoid direct sunlight because you could burn. Serenity is anxious feelings, which is often associated with hormonal imbalance, especially perimenopause. Frankincense, you get cellular renewal, DNA repair, and it's great for the skin. Geranium is hormone balancing. Lavender is sleep, and it balances hormones as well. Thyme oil, it benefits the body by improving progesterone production. So as we said, perimenopause, 75% drop in progesterone. If you want to uplift it, use thyme oil. And also with estrogen, which drops by 30 or 35%, fennel oil is good for boosting estrogen production. So there are ways to use that, and I can give you guidance on that. So you could make your own blend, like in a roller bottle. I've added one here. Add some clary sage, ylang ylang, and thyme oil. So if you prefer to do this instead of a full aromatic dressing on the inside and outside of the ankles, because that's a reflex point of the ovaries and uterus. Okay, so I touched on gut health earlier. Let's talk about gut health. 80% of your immune system is in your gut. Your hormones are produced there. Some of your hormones are produced there. So you want to, if your gut is compromised, your hormones are compromised, right? We have trillions of bacteria in the system. We want to have a ratio of more good bacteria versus bad bacteria because we still need bad bacteria. So taking, probiotics daily is a good idea to keep your gut healthy. Eating gut healing, nourishing foods such as sauerkraut, kimchi, kefir, organic yogurt, coconut yogurt are great to balance your gut health. Cutting out dairy, especially if you're lactose intolerant, is a great idea because dairy can be bacteria forming in the gut. So you want to be able to cut out the dairy products, especially if you're lactose intolerant. So putting your well-being first and steps in place to deal with your emotions in a positive way, as well as heal your gut through proper eating, good supplementation, and healthy lifestyle changes are key to healing your body and soul. Okay, so let's talk about stress. So in our busy lifestyles, with all the distractions and demands, you rarely have time to realize how stressed you really are. Stress has a significant impact, like I've mentioned so many times, on your hormones and overall health. Learning what your stressors are, how it affects you emotionally, physically, and mentally, and best of all, identifying the right tools to help you manage it properly is key to keeping your body in balance, right? So here are some ways to include natural stress relievers: connecting with family and friends, spending time outdoors, meditation, prayer, yoga, mindfulness, going out to dinner, whatever it is that will bring down your stress level, do that, right? So these are just a few ideas. Now, the other thing is your liver. When the body produces estrogen, it tends not to use all of it. So the liver is responsible for excreting the excess estrogen. If it's not able to do that, it gets recycled through the body, which causes estrogen dominance, which can lead to health issues. It's important to keep your liver health in shape so it's able to perform at its optimum, right? So help your liver along the way. Don't clog it. Another way to help your liver, to support your liver, is to do what is called a castor oil pack, which is, I have an ebook on that. So if you want to know more about it, to help the liver function properly, give it a break, is using castor oil and a flannel or a small towel on your skin over your liver area with some warm hot water bottle. You lay down for about a minimum of 30 minutes, and that helps the liver to heal and do what it's meant to do, right? So that's supporting your liver. Okay, I'm just seeing some questions come in about HRT, which I've answered already, and soy products, which I've answered already. So once you get the recording, please go through the recording and you'll have the answers to the questions on HRT being natural, which is the bioidentical HRT, right? Okay, so those are the natural holistic tools that you can use to support yourself through the perimenopausal symptoms, right? I know a lot of women feel like, they can't take time for themselves. They feel guilty, especially the moms. So here's my thing. I love this quote. It's not selfish to love yourself, take care of yourself, and to make happiness a priority. It is absolutely necessary. Okay, so that's what you want to try to do, to actually take time for yourself. So you're helping your body, you're reducing the stress in your body and helping your body heal and thrive. Okay, so learning to slow down and reconnect with your body is the key to resetting your hormones and reversing your symptoms. Finding and adopting the right tools and activities that work specifically for you and your body type will help nurture your body, mind, and spirit. So let go of self-limiting belief that you can do this on your own. It can be so easy and simple to overcome your struggles, not temporarily, but for good, with the right help. Okay, so here's the thing. I have a brand new 6-week digital program, which is the ultimate perimenopause healing protocol. It's your guide to weight loss and thriving in your 40s and beyond. This contains information about, what I do, the tips and tools and the protocol I use on a daily basis to support myself. It has a lot of the information and it's self-paced. So you can do this at your own time, in your own time and at your own pace. So the program will help you reset, calm the perimenopausal symptoms, increase energy, balance your mood, lose weight, improve your skin, and strengthen your immune system so you can live your best life through the transition, right? So what are you going to get? You're going to get access to information and tools required to help you reset your health and hormones. You're going to understand the root cause of the issues you've been experiencing and get answers to your burning questions. You're going to get clear to create health and lifestyle plans to enable you to achieve your health goals and live a more energetic and vibrant life. And here's the final thing. You're going to turn 2022 and beyond into years of phenomenal health, growth, and transformation, unlocking the possibilities you never knew. So why am I doing this? My mission, ever since I started on this journey of coaching people, holistic health, especially women, even though I do corporate well-being, I work with corporates to build well-being strategies as well. But my passion has always been to help women. And my mission is to recommend the important lifestyle choices, the holistic lifestyle choices for women that have been proven daily, day in, day out in the holistic world, that the people are adopting the holistic way of living to be relaxed without excess tension or stress, and specific to your hormonal and perimenopausal needs. So this exclusive offer, I'm pre-launching it. It's a pre-launch offer that's happening from today, up until enrollment opens. So enrollment doesn't open, or I missed putting that there. Enrollment opens on Monday, the 13th of June, right? So you have between now and enrollment day, 13th of June, which is just shy of 2 weeks, to enroll on the pre-launch offer price of $47. Okay, so now is the time to take advantage of this. Once we hit enrollment day, once enrollment opens, the price is going to change and I will never offer this price again. So I will be sharing the link to all the information of what you get on the program, what's involved, and how you can get access at the pre-launch price. Okay, so that's all the information I have for you. I really, really hope this has been useful for you, and hope that a lot of the tools that I've shared, you will take at least one of them and start to incorporate it into your daily routine and lifestyle, so that you start to feel better and start to get all the benefits from going to nature. And if you feel like you still have to embark on the HRT, on the conventional type of treatment, everybody's individual, right? Yes, the holistic method takes longer, but like I said, when you embark on HRT, sometimes it depends on the woman, on each woman. But the thing is, it takes some time before you actually start to feel the benefits. And then, you're ingesting synthetic hormones, whether bioidentical or not, it's still made outside of your body, right? You want to trigger your body to produce, to get that balance in the hormones, okay? So I would like to take this opportunity to thank you for being here. And hopefully this has been a good session for you, very informative for you. And if you want to reach out to me, that's my email to reach out to me. Jump on the website. And like I said, I will share the link to the details of the ultimate perimenopause healing protocol so that you can find out exactly what's involved, what's in it, and take advantage of the pre-launch offer, right? So all that's left for me to say is I wish you good health, and may you continue to thrive and be the fabulous person you are. Okay, take care.